You're listening to Ask the Expert with Andrew Johnston. Welcome, everyone, to this episode of Fast Facts, Ask the Expert. I'm your host, Andrew Johnston, and this week we are giving you the definitive answer about patients wearing safety glasses. So the question gets asked, whether it's out loud or maybe it's just in your own head, do my patients really need to be wearing safety glasses? And the answer is, most of the time, yeah. And before we tackle some of the reasons why, let's talk more about the reasons we feel like we should not hand those glasses over to the patients in the first place. So first, are we worried about the optics, the patient's perception? Are they going to reject us? Are we not doing it because potentially we're not sure that what the reason is, or just don't want to have to give a reason to the patient to wear them if they kind of just like stare at us and be like, well, why do I need these? And we don't want to have to get into that whole dialogue because that is kind of annoying too. Or is it more the fact that, we don't give these glasses to the patients because we don't want to spend time to disinfect them in between each patient appointment? We definitely have so many things to do. And basically it's a two-step process to disinfect most glasses. And then also there's the spots that are usually there. So we have to spend time removing the spots so the patients don't think that the glasses are dirty, even though they're absolutely clean. And so, what are the reasons that, if you're someone that's listening to this and you're like, you know what, I'm not really someone who does that for all the procedures. Like, what is it in your head? Like, what is stopping you from making the decision to not insist that your patient wears glasses? So the ADA has written a policy about this too. If you want to do a quick Google search, but basically in that statement, they echo the sentiments of the CDC, which basically gives a recommendation that all patients should wear glasses for procedures that might produce, and this is coming directly from them, spray or spatter. So they're more concerned with that type of thing happening. And I think the example I want to talk to you about on this one is kind of a pretty darn far leap. But think about the infectious materials that might live in a droplet of an infected patient, whether they're just maybe one chair over, or maybe it's, something that's maybe closer for whatever reason. But imagine, like, due to freak events occurring, that infected droplet lands smack dab in the middle of your patient's eye, who is just casually reclined in the seat. That's kind of what they're talking about with their spray and spatter. I think that we can all acknowledge that's not super likely to happen. That's more likely that the patient's own saliva and or blood are really potential problems here through spray and spatter. One thing, though, I don't like about the limitations that the CDC statements have in here is that there's no discussion of foreign matter, such as acrylic from denture adjustments or small pieces of metal from clipping ortho wires that might just jump off and hurt somebody, even though usually the pliers are magnetic. There's pieces of tooth from whether it's an extraction or whether they're prepping with a handpiece. There's all sorts of things like that could happen, but there's also the matter of dropped materials. So the CDC, again, was saying blood and bodily fluids, but what about bonding agents being dropped as they're being passed over the patient's face, or acid etch, amalgam crumbs or composites, cements, all sorts of other materials that we use. We also have instruments that we haven't talked about, scalers, mirrors, even syringes. So if you're thinking to yourself, like, look, I'm not dumb enough to pass anything over a patient's face, you're probably right. Not very many of us would do that. But there are also situations where a patient's sudden movement, their physical reactions, a hand flying up or an arm flying up can cause a jostle or a spill. So it's not just the people that are being careless or negligent, it's the people who also have best intentions as well. So the reasons for making sure that there is not eye injury to the patient is beyond because we're going to have a malpractice insurance claim or there's going to be lawyers and lawsuits involved. It's going to be beyond the fact that the ADA told us to and the CDC recommends it. That's not why we do the things that we do. We do it because it's about being a decent human being, a decent neighbor to your patient. We have to protect them. That is our responsibility. Get them healthy and keep them safe. I just bought a dozen patient glasses on Amazon for the dental trip we did in the Philippines. I'd have to look again, but I think it was a whole $12. Totally affordable to just do the right thing. So please do it. As always, if you have any thoughts or questions about this, send me an email, andrew@atalo2hygienist.com. And there you have it, your definitive answer. Yes, patient glasses. All right, everyone, enjoy your week.
Thank you for listening to Fast Facts, Ask the Expert. If you have a topic you'd like one of our experts to answer, simply email me, andrew@atalo2hygienist.com, and we will get it on the air as soon as possible. Thanks for listening.